How did you get into this?
So the reason why I decided to become a plastic surgeon was it happened to me in grade school. So when I was in grade school, there was a girl in my class who had a cleft lip and palate deformity, and she was on my bus route, and kids would torture her. It was unfortunate, but especially back then, because now we're very focused on anti-bullying and like you can't get away with the behavior that used to happen when I was a kid. But people would throw things at her, and they would, assault her. Nobody would go near her. They would, and it was because she had a facial disfigurement, unfortunately. And I was her friend. I used to sit on the bus with her. And the thing is that she had surgery during the time that I knew her. And as her appearance started to morph and become more normalized, people started to respond to her differently. And I thought that was a very powerful thing.
Welcome to episode 142 of the Mikhaila Peterson podcast. I'm Mikhaila Peterson. I'm backstage at one of Dad's show in Denver, as you can see. This episode covers plastic surgery, the real secret to staying young. I mean, there's also sleeping right and diet, hello, low carb, and sneaky tricks like NAD. But if you see a 70-year-old and they look like they're 50, it's plastic surgery. Dr. Andrew Jacono is a world-renowned facial plastic surgeon based in New York City, author and creator of MADE, a minimally invasive hybrid facelift, the secret behind celebrities' ability to never age. I've always found plastic surgery fascinating. If you look younger, do you feel younger? If you feel younger, do you live longer? I don't know. Andrew's the founder of the New York Center for Facial Plastic and Laser Surgery and the co-founder of TIE, a non-profit organization that helps children in third world countries get free plastic surgery for things like hair lips, life-changing surgeries. He's been named one of America's top plastic surgeons by Harper's Bazaar, the Consumers Research Council of America, and Super Doctors. He starred in the TV show Facing Trauma as a volunteer surgeon for victims of abuse. Dr. Jacono has been featured on Good Morning America, Anderson, and CNN, to name a few, as well as many publications like the Huffington Post and GQ. His main clients are lawyers and CEOs in New York, as well as celebrities and the average person who knows about this stuff. We talked about the ramifications of social media, the type of person who does plastic surgery, the dangers, the morality, and more. I hope you enjoy this conversation. This episode was sponsored by Paleo Valley. We need collagen. It's like the glue that holds our body together. We're talking about plastic surgery in this episode, but I did mention diet is playing an important role in aging. After we hit 20, we begin to produce less and less collagen. A simple way to get a good dose of collagen is Paleo Valley's bone broth protein, something I can actually eat. It's made in a pesticide-free environment and made from 100% grass-fed bones, not hides like a lot of other products. It's also delicious. You can add it to smoothies, baked dishes, your coffee, or just mix it with hot water and a bit of salt, like me. Adding collagen to your diet will not replace a facelift, but it certainly won't hurt. I absolutely love it. It's kind of like coffee. If you haven't tasted coffee in years, it's great and is on sale now at paleovalley.com with code MP for 15% off your first order. That's paleovalley.com, code MP for 15% off. I hope you enjoy this episode.
Dr. Andrew Jacono, welcome to my podcast.
Thanks for having me. I'm super excited to talk to you.
Yeah, this is going to be fun. I think what you do is something everybody should know about. So before we get started, can you give a brief background about who you are and what it is you do?
Sure. So my name is Andrew Jacono. I'm a facial plastic and reconstructive surgeon, and I practice on Park Avenue in New York City. And I specialize in facial aesthetic surgery. So things that are to enhance people's appearance, both aesthetically to make them achieve their goals for their beauty, but also to rejuvenate the facial appearance to make people look younger. And as I get older, this becomes more important to me.
Okay, so I want to cover a bunch of things. I want to cover like what you do and then how many people actually do this kind of thing, because I think people don't talk about it. And then some of the ethics behind plastic surgery. So that's what we're going to kind of get into. So first off, what percentage of your clients do you think are women versus men? Like how frequent do men come in?
Yeah, I mean, at this point, it's changed a lot. So I think that, the modern era and how aware we are of our appearance, and that's been obviously accelerated by, digital cameras, our social media presence, using, digital platforms to be able to communicate and work. Men have embraced plastic surgery at rates that I've never seen before. I've been doing this over 20 years. And I would say that 20 years ago, that males comprised about 10% of my practice, but today it's fully a third. So that's a lot. It's 1 out of every 3 people that I operate on are male patients. Yeah.
Wow. Okay.
Again, it's not surprising because everybody wants to put their best face forward. And the reality is that our face is our calling card. In the modern era, before somebody even meets you, they Google you. They look at your images. They look at your social media content, and they make judgments about who you are, how effective you are at your job, and they get a sense of your personality by the way you look. And that's what we do. I mean, it may not be correct, but the truth is that today we judge a book by its cover. And it's not right, but it's the natural tendency because we live in a very visual world now.
Yeah, especially with social media. So what age do you think your average patient is?
Well, my age definitely tilts younger. I mean, older in the older age category, I should say. I specialize mostly in aging face surgery. So that means that I tend to take care of people as their appearance starts to change as they get older. In the past, I would say that would be an average age of somewhere in the mid-50s. But today, it's really patients primarily in their 40s. So people are embracing enhancing their appearance at a much younger age today than they did 20 years ago in my practice. Obviously, there are patients who come in who are young, who have the desire to change their nose or their lips or their facial shape because it's disproportionate or imbalance. Like a young girl who's 18 years old who unfortunately got her grandpa's nose. Like the whole family has a big nose, so she looks more masculine or like male members of her family, and she wants a rhinoplasty. Those obviously will be younger patients, but on average, I'd say that somebody in their mid-40s at this point, early to mid-40s.
Okay. And what kind of procedures do you do? Like let me rephrase this question actually. If somebody wants to have a surgery to look younger, what is it that makes people look younger?
Yeah, so the thing is that it's not one thing. So this is really the artistic aspect of what I do, is that there are multiple things, and it's different for every face, that create a more youthful appearance. And so as a result, it's often multiple procedures. It's not one big procedure. And that's what I try to stress to patients. It's not like a big facelift or a big brow lift or lots of eyelid surgery. What makes people look youthful is not a lot of surgery. It's little bits and details throughout the different proportions of the face. And that's what makes people look youthful, but also natural and normal. Because obviously the biggest fear is that we're going to do plastic surgery and we're going to look like a freakazoid. People don't want to look like the picturesque celebrities that they've seen who've had plastic surgery. They want to look like themselves, potentially a little bit more enhanced, but arguably like they did maybe 10 or 15 years ago. So the thing is that often for me, when I'm doing a procedure, it's a combination of things. The thing that I'm most well known for is for doing facelifting surgery. So it's called a deep plane facelift. It's a procedure that I pioneered and I lecture about all over the world. I publish textbooks on it. But with that is often things that are done like a temporal lift to rejuvenate the upper brow, eyelid surgery to help smooth contours, lip lifts, because unfortunately as we age, the lip droops and the upper lip becomes elongated, fat grafting to add volume to places in the face where people get sunken as they get older. So it's really an artistic endeavor. What I'm doing is I'm looking at the face and I'm creating contour and balance. And that's what makes people look young. So it's kind of a difficult question to answer, and I apologize that the answer was so long.
Well, that makes sense though. So when you do these procedures, do people come in and they have a whole bunch of things done at one time, or do they come in every 6 months?
Yeah, it really depends on the personality of the patient. What I definitely notice is that most patients do, I'd say 70 to 80% of patients do it all at one time. And I think that's just because of the recovery time required. If people are going to go and take that much time away from their normal life for recovery, i.e. social activities, work, all those things, they don't want to have to, have seven to 10 day recoveries. They'd rather try to see if it can be done at one time. But those are busy people who have lots going on in their lives. And then there are other people where they're not so motivated. They have a lot of free time and they'd like to chip away at it and do a couple of procedures at a time or one thing at a time. There's no right answer. You can do it either way. But I think that in modern era and, what we're dealing with, people want to be able to get things done and then be able to move on with their lives and enjoy the outcomes of their surgery, not make it a project that's going to take them 2 years to get through, and 10 weeks of recovery. They'd rather be like going to St. Bart's for a vacation versus, sitting home and recovering and being bruised for that period of time.
So did you say 7 to 10 days?
On average, most recoveries for most of these procedures, you can get out about 7 to 10 days afterwards. It doesn't mean you want to be, hosting a dinner party at your home with people that you don't want to know who had surgery. But functionally, the majority of my patients, even professional patients, physicians, attorneys, people who are financial bankers, they get back client facing or in front of people at around 10 days. I tell them if they can get 2 weeks, it's ideal, but it's hard. So you can cheat it in 10 days. And we have ways of making the recovery much faster today that just weren't available 10 years ago. So I have things that I can do, techniques and instruments and lasers that help recovery, get rid of bruising. There are different treatments that we do. One of them is hyperbaric oxygen treatments, where you go into a hyperbaric oxygen chamber every day and increases the blood supply and the oxygen content of the tissue, so the healing is much faster. And I've learned these things because a lot of my patients need to be back in front of cameras really quickly. I take care of a lot of people who have public faces. And as a result, I needed to figure out a way to get them back to work quicker because they don't have a lot of downtime between, shooting television shows or other things,
What percentage of celebrities or people who have TV appearances who are, in their 50s or 60s have had work done, do you think?
Oh, so pretty much everybody who's 50 and above has had work done. So if somebody,
men too.
Yeah, men can cheat it till about late 50s, early 60s. So there's definitely an unfair disparity between men and women in terms of the way they age. Women, generally speaking, around 50 start to age more rapidly. And by 52, 53, their face really changes. That's because women go through menopause on average at about 50 to 51 years of age. And within 2 years of that change, the facial tissues drop. So unfortunately, there is a big change and a shutoff that happens for women that accelerates their aging process. So on average, most women will consider this if they aren't more proactive about doing it around 50 because they notice that things just don't hold up nicely the way they used to. Men get a pass. It's usually around 60 that this stuff really starts to come apart. So I usually will treat most men later 50s to early 60s and most women later 40s to early 50s. So that's when I kind of see it. But if you see a celebrity who's in her early to mid 50s and she looks youthful, she's had surgery. Nobody escapes this, unfortunately. I've been doing this for 20 years and I've done about 4,000 facelifts. Nobody escapes this. And it doesn't mean that they look abnormal, because with good surgery, people look natural, like themselves, but youthful. But you can't be 53 years old and look like you're 40 without surgery. It doesn't happen. Okay,
so it's not all olive oil then.
Okay, I don't want to comment on that, but it's not all olive oil. I guess I just did. Yeah, it's not olive oil. It's not regimens. I mean, I give these excuses to my patients. When they say, well, what am I going to say when people tell me how great I look? I say, well, if you look natural, you won't say anything. You tell people you lost weight, you've been drinking green juice, you've been doing more meditation. People associate a youthful but natural appearance with good health. So it's very easy to blame it on things like olive oil, your diet, your antioxidant drinks, your vitamins, a new skincare regimen, because if you look normal, nobody really gets it. It's only when you have the distortion and the classic look that comes with, more antiquated facelift surgery or plastic surgery that it gets a big alarm. So I give people these excuses all the time. I'm like, just tell people that you did these 3 things, or that you had a little bit of Botox, or you had some, intense pulse light therapy treatment in your dermatologist's office. it totally throws people off because they're not really looking at surgery. They're looking at somebody who looks good and healthy and youthful, and they want to know what your secret is, but they don't think it's surgery. They think it's lifestyle choices.
Okay, so what are the downsides here? Like, is this type of thing super invasive? Is it dangerous? Do you need to go under general anesthetic?
No, so we don't use general anesthesia. At least I don't. A lot of surgeons do, but we do something called twilight sedation, which is where you get a little IV and they give you some medicine that just makes you kind of sleep, but you're not paralyzed with a tube in your lungs breathing gas. So it's not something where it's like a heavy anesthesia that's very risky. Obviously, all surgery has risks, so it's not risk-free. But the thing is that when you're with an experienced practitioner, your risk of having a significant complication from surgery is probably less than 1%. And even then, those problems, if you have one, can be managed and remedied. It may require another surgery, but nothing is risk-free. But it's not super risky. We obviously have advanced our techniques. We have advanced instrumentation that keeps people safe. And if you can do it with less anesthesia and you can do it in a more minimally invasive way, which we do, old procedures had huge incisions all around the face. They used to peel everything off, and it was a bigger deal. Now we can work through smaller incisions, with our technology, and we can do it in a less aggressive and less invasive way that's less risky, but also makes people look more natural. The downside is it's surgery. It's not risk-free. There is a recovery. It's not comfortable. After surgery, there's pain involved. It's scary, and that's the truth. But when you get to that point where you have a resolve about what you want for your appearance and how you want to project your appearance to the world, people kind of accept those things and they get through it. And, after a couple of weeks, it's like, it's not that big a deal. And then you get to enjoy the benefits of it for a very long time.
Interesting. Okay. Are there techniques for anti-aging that aren't surgical that you could recommend? Like, does Botox work? Do fillers work? Are there lasers that can resurface skin? Like, does anything else work? Are there creams?
Yeah, there's lots of stuff for sure. Good skincare is always wonderful and important. But from a skincare perspective, the most important thing from my perspective, and I don't prescribe skincare, and I have good dermatology colleagues that work in cosmetic dermatology that I refer to. But the primary thing that I think that's important is you should be on is some kind of a retin A or a vitamin A derivative. And those are skin creams. Retinol is like an example of it, but retinol is not that strong. But prescriptive retin A thickens the collagen layers of your skin and it prevents aging. It actually supports the thickness of the skin and the protein layers that tend to thin out as we get older. So that's a really important thing to do. And it's something that people should do throughout their life because it definitely will help minimize how much the skin falls and wrinkles. So that's one thing. Botox is wonderful because when you put Botox in, if you're not flexing your face all the time, you don't develop lines and wrinkles in the forehead, around the eyes. It helps support the brows. So it prevents aging. So Botox, even though it can be costly over a very long period of your life, because if you started younger, say in your mid to late 30s, and you continued on with it for a long time, it gets expensive. But is it worth it? Yes, it is. Fillers, you have to be very careful with. And I talk about this a lot and lecture all over the world about it. The problem with fillers is they create something called a tissue expansion effect. And what that means is as you put filler in, you stretch the tissues out. When you stretch the tissues out, it's like a pregnant woman when they have a pregnant belly and they lose the pregnant belly. There's a lot of skin that it develops and it hangs. So a lot of women get tummy tucks because the skin has been so stretched out after pregnancy. Similarly with fillers, if you overdo fillers, you will stretch your face out. And if you do that, it'll actually make it drop more quickly. So one of the big problems that I deal with in my practice is women who started fillers too young because they thought they were preventing their aging, but they stretched their face out. So they need a facelift much younger than they probably would have, sometimes by even a decade. So fillers are good when done with small quantities with an even hand. But when you start blowing things up too much, unfortunately, this can be a significant problem.
Wow, that's something people should really know about because you go on Instagram and it's like, oh, do the, Kylie Jenner package or something. And it's
it's easy to market and it's simple. It's not surgery. It's just a couple of injections. And sometimes it can look really good. But the problem is how frequently you do it and how much you do it one time. because it can look good the first time and the second time, but sometimes after people doing it the fourth, fifth, the sixth time, as they continue to age, they're putting more and more stuff in to try to recreate the same effect. But our aging face doesn't recreate the same effect with the injections that it did, say, 5 years ago or 7 years ago. So people try to use more to get what they used to get, but then all they do is they stretch their face out.
Okay. And you mentioned something about fat grafting.
Mm-hmm.
So what's the difference between that and just having a facelift?
So fat grafting is just like using filler. It's just using your own body fat. So the thing is that any place where you could use filler, you could do something more permanent with fat. Similarly, fat can cause the same problems that fillers can. So it has to be done evenly and not too much. But the other problem is that if you put a lot of fat in the face, it can weigh the face down because it has more weight than filler does. So similarly, with time and age, fat grafting tends to drag the face down because it's like strapping two weights into the face. So all these things are a matter of degree, but it's more common for me not to do fat grafting in younger patients. And here's the reason why. Fat is a hormonally active tissue. So when women go through changes and start to have hormonal changes as they age, a lot of women start to gain a little bit of weight. And it's not because they're not trying hard, but it's a lot easier to stay thin when you're 20 than when you are when you're in your mid to late 40s, right? For everybody. The problem is that the fat that you put in the face acts like the fat from your belly. So if you start to put weight on in your body because your metabolism's changed, guess what happens to the fat in your face? It grows. So what I see is a lot of women who had fat grafting in their 30s whose faces now are getting big and distortive. And they weren't like that when they were younger because the fat was one size, but as they put weight on, the fat in the face grows like as if it was in the belly because it behaves like where it came from, not where it was placed. So the face gets very distorted. So for me, fat grafting, I prefer to use it in patients who are older, who have already been through some of those metabolic changes versus trying to use it as a substitute for fillers. Fillers can be dissolved away, fat cannot. So when you have a problem with fat grafting, it becomes a big surgical problem that a lot of people would prefer to avoid. And you learn these, this is the thing. When you do so much of this, and I've done so many thousands of surgeries, I've made a lot of mistakes, and I've learned from those mistakes over the years. That's what happens. That's what good surgeons do. So as a result, I know how to avoid more of those problems for my patients, and I know who the right patients are to direct to what treatments in what amounts at what time in their life.
That's wild that you can graft belly fat or something like that, and then it'll gain weight like belly fat. That's crazy. I bet people didn't expect that.
But that's where it came from. It doesn't change its character. We're using it to like resupplement, but it has the character of where it came from.
Wow. Okay. That's very cool. Okay. So now that we have a bit of a background about all this, actually, no, one question first. So you said facelifts used to be a lot scarier than they are, and you used to end up with just like scars everywhere.
Yeah, very visible scars and very long incision lines. So it would be very, very hard to camouflage the surgery. You know, you'd have to kind of wear your hair down and hide everything as much as you could. And if you ever had to go and get your hair cut or jump in a pool, everybody would see these horrible scars everywhere, which is not fun. Nobody wants, I mean, even if you look good, you don't want to have a visible telltale sign anywhere. You want your face to look normal, but you also don't want to have, visible scars that tell everybody where you've been and what you've done.
Mm-hmm. So what's the difference between that and now? Like, how come there are so many older celebrities that are in their 60s that look absolutely fantastic and they don't look like they have any scars or people can't tell? Otherwise they'd be, all over the magazines.
Because they've had good surgery, There are lots of great surgeons out there. When somebody's at like an award show and everybody's like, holy crap, what happened to that person? Mm-hmm. Knows they had, not a great procedure. And they probably had a technique and an approach that was, used decades ago. But that still happens a lot. There's a good and high percentage of patients who go to doctors who have those techniques. And then there are more evolved techniques. And unfortunately, probably a smaller percentage of surgeons are educated and capable with those techniques. But those are the people that you see who are 60 years old and a celebrity, and you're like, she looks great. Like, you don't say, oh my God, she looks X age. You just like look at her and you can't even perceive her age because she just looks fantastic. That's the beauty of the plastic surgery.
I've always wondered if there was any correlation between looking younger and age length, age span. I don't know if or lifespan. I don't know if they've done any studies on that, but I've talked to people who've had procedures done who look now 15 years younger, and they say they feel younger too.
Yeah, I definitely think that there's health benefits, but I think it's because when people look better and they're more prideful of their appearance, they tend to lead healthier lifestyles. So people who have a better, more youthful looking face will often exercise more. They'll eat more, more carefully because they want this to match this. So I think that it sets in motion habits that make people live a longer and potentially healthier life, for sure. So that's where I think the link is. I don't think it's generated in the brain. I think it's generated by habit that's just reinforces better habits. And I've seen it over and over again. I do a procedure on a patient, and then I see them 6 months later and they've lost 25 pounds and they look fantastic because they're like, well, this looks great. Like before, my body wasn't my concern because my face really didn't look great. Now this looks fantastic, and now my body becomes my concern, because I want it all to look great together. So that's where I think that comes in.
Okay, that's very interesting. And then how do you feel about the ethics of how popular it's become to surgically enhance yourself, and like, I guess the costs associated with that, and whether or not certain people can't afford them, richer people can't afford it, and I don't know, the morality.
Yeah, I mean, it's a very hard thing to, I guess it really comes down to your politics in a lot of ways, right? I mean, if you're more of an egalitarian, you get tweaked by it because you feel like it's unfair that people who have more money have access to this, because the truth is, unfortunately, is that because we judge a book by its cover, when people are more youthful and more attractive, their lives tend to be better. And I know that firsthand. They get more job opportunities, they have better relationships, they have more confidence. It builds a positive spin on their life. And it's effective, for sure. And it's not the reason why people do surgery, but lots of things evolve in a very positive way when somebody suddenly looks 20 years younger. Like if you're 60 years old, people tend to think of you differently. How effective you are in your workplace, how friendly you are. People, as they get older, they look sad, they look angry, they look less approachable. People avoid you. You go out in public and you look 40, all of a sudden the whole world seems to open up. So it's not, fair that people who have more means get that. So I think that if you're more of that camp, then I think you feel like there's an ethical dilemma there. I don't really think that's the case. For me, there are ways for people to have surgery, and you don't have to have a ton of money. There are lots of options for surgeons. Surgeons charge different prices. There's ways to finance surgery just like you would a car. Buy a Hyundai, and I would tell you that you can probably get a pretty good surgeon if you finance the cost of a Hyundai. And I would arguably say that, the value to the person in terms of quality of life is probably more valuable than a Hyundai, depending on where you are and what you're trying to achieve. So there's ways of getting it done. You don't have to be ultra rich in order to be able to have plastic surgery. And the question is that why does it matter so much? And should we value appearance as much as we do? And that's the hard part, because for me, I have 4 children, and the thing is that as a parent, it's not like I think everybody should have an archetypal face. I don't think everybody should have perfect balance, symmetry, and beauty. I think there's a lot of beauty in not having all those things. But it's like trying to tame the beast at this point, because of our visualization of beautiful people and youthful people, and how it's pushed on us. It really is. And we have sponsored ads that pop up all the time. Everywhere we go, we're aspiring to look a certain way. There's a celebrity we idolize. There's all this constant visual imagery, and that it's not great, because it makes us feel inadequate. It makes us feel less than. and unfortunately it creates a certain dysphoria that drives people to have plastic surgery. But unfortunately, I don't think it's plastic surgery that's driving it. It's not surgeons like me who are creating the need or want it to happen. But we're serving, we're providing a service to help people manage the modern era. And I don't like it, even though it's what I do for a living, right? So it's what I do, and I love doing it, and I make people happy doing it. I think it's an unfortunate side effect of the society we live in. And one of the big things for me when it comes to that is I feel like social media companies need to be held responsible for their behavior. And that's something that I know right now is very much in the forefront of people's minds. Because the truth is that if social media companies are held accountable for their behavior, you can't sue a social media company. So if they do horrible about ourselves, there's no recourse. But what they do is they manipulate content, they drive it in front of us, they make people feel horrible. There's tons of studies that show that the number of younger people who are adolescents and young adults who feel inadequate, who have poor self-image and body image because of social media, it is a problem. And the thing is that they curate content and they know how to drive it to you to keep you linked onto their platform. And they manipulate the hell out of everybody. And it actually creates the desire for these things more than it would exist if we didn't have these things around. So for me, the real ethical transgression is not in wanting to do plastic surgery or executing it. I feel like the platforms and the way we get information today is so manipulated that it's targeting us in order to make us feel like we need to be other than who we are. And that's what frustrates me. Because as a father, I don't want my children to feel like they're not adequate, that their body type isn't good enough, that their face isn't beautiful enough, because there's beauty in all shapes and sizes, but it makes us feel that way. So for me, that's the big dilemma.
This episode is brought to you by NordPass. Do you work in the cloud? Have you ever wondered what would happen if you lose your passwords, or even worse, you get hacked? Business and cybersecurity are inseparable nowadays. Everything we do is connected to the internet, stored in the cloud, so it's crucial to protect business operations and information and make sure you can control who can access that information. Save time, secure notes, not just passwords, keep track of your password health, and log in faster with NordPass. And there aren't even all the features listed there. NordPass is amazing. You can take advantage of their new huge offer right now. From March 11th, get 50% off NordPass Premium plus 1 month free at nordpass.com/TMPP, like the Mikhaila Peterson podcast, in case that needed clarification, or use code TMPP at checkout. If you like this content, please remember to hit subscribe.
I don't remember where it was. It might have been a country that said they were going to make editing your photos illegal, right? I can't remember where that's happening, but I've seen the impact of social media on my cousins. I have a couple of teenage girl cousins, and it's rough because every single person that they follow edits their photos in ways that humans can't really look. And they feel ugly. Yeah.
Yeah, but you know what's so funny? These people have had plastic surgery. So they've had plastic surgery, and then they're editing their photos on top of plastic surgery. So it absolutely is the case, because you feel like, well, what's wrong with me? All these people look flawless. Shouldn't I look that way? Because obviously there's a certain, worship that we have for our, the people we look up to. And it's in all fields and it's in all ages. Maybe a younger person looks up to, a famous person. I look up to my heroes in my professional world. The people that are the giants and the people that I learned from. Who made a lot of advances in my field. So we all look up to people, but the generation definitely looks up to people who are more beautiful and more archetypal or are the best in terms of their appearance. And it's really unfortunate, but everybody seems to manipulate their images. And it's so funny because you look at these magazines sometimes and they always have like little arrows showing where you can see like the edges of a photo looking all like, janky and like crooked. The person sitting there and their waist looks this thin, but then you see like the bricks like having a distorted pattern around them because they just crushed the pixels. So it's like sometimes it's really goofy and obvious. But again, getting bombarded with that imagery over and over again really wears away your brain and makes you feel inadequate.
Yeah, it's a bit of a pickle. It's definitely a bit of a pickle.
Yeah, but it's a pickle, but I think it's a pickle that can be solved, because once these companies are held accountable for their behavior, they will change their behavior. Because if you can imagine the financial downside of a class action lawsuit of tens of thousands of families who had children who wound up with mental illness or suicide, it would be in the number of trillions of dollars. But the thing is that right now, there is no repercussions. They can do whatever they want, whenever they want, and there's nothing you can say about it. So once that happens, I think that they'll be more responsible with what they do. And they can even enact policies where come on, we have such technology. They should have the ability to use technology to make sure that those kind of images are not allowed to be posted. Like, that's a possibility. Why should that be allowed? If we know it's causing significant, pervasive public mental health problems, which it does, why don't we hold people accountable to make it different? We should.
That's a very good idea. That's a very good idea. I don't know why that wouldn't have been. I guess everything is so new. Social media is so new. It hasn't been around long enough for people to.
Yeah, but I think that the reason why is, at the end of the day, is that all of these companies, all they really want, they're not concerned with ethics. They want more eyes, more volume, more clicks, and more ability to then, because of the volume of traffic, be able to sell advertising. It is a business. So if a altered image gets more attention than an unaltered image, they prefer the altered image, right? Because if it's going to get more views and clicks, then that means more revenue. And that's really what they are at the end of the day. They're for-profit companies, they're publicly traded, and they're motivated by profit like all corporations are. But when it has pervasive mental health complications for us as a society, I think that we need to take a step back and hold people accountable for their behavior. And this is like getting way off target from what plastic surgery is. But because of what I do for a living, I see how devastating it can be over long term to people, young and old.
Do you have people come in that show you pictures of clearly altered faces and say, I want this?
Absolutely. So especially younger patients, they come in with their iPhone and they have like a file of screenshots of people whose appearance they covet. I like this nose, I like my lips this way, I want this like this and this like that. And obviously you can't transplant those things on patients. So you need to be educated and you have to go over with them what's possible, what the limitations are, because not every nose and every face can just be made into something. You can get parts of things. It has to do with what you start with. It's not like you can just plug things on. It's not plug and chug. It doesn't work that way. But it is very, very common for people to show up with that kind of information to a consultation.
Do you have advice for people who are potentially interested in this on how to avoid bad surgeons?
Yeah, I mean, I think that where we live in a modern era, and people have access to information. So I think it's pretty easy. I mean, people do deep dives on everything, right? People are going to buy a vacuum cleaner. And they go online and they read about the vacuum cleaner and they read about people's online reviews and what their experience is like with it. You can get a lot of information out there. So I think that's one of the first places to start, is by doing that kind of deep dive and research into people. People have different expertise. If you want a rhinoplasty and, you go to a doctor and you see that mostly what he does is breast augmentation, it's probably not a good idea. But, this is the kind of information that you can get by just spending some time. And then after you do that, you should, see a number of doctors. And I always say this, you should go with your gut, because, sometimes we can be intimidated. We're in a situation where somebody's supposed to be, a very, well-known or professional person. And it can be difficult because you're like, well, this person's supposed to be so great. I really should just have them do it. But you really need to listen to your internal compass, because, beyond, doing your deep dive, not every, doctor is going to be the right fit for you. And obviously the doctor just doesn't have to be a good technician, but they need to be a good person because they need to see you through the recovery phase of your surgery and be able to address concerns as they arise. And if somebody seems to be short, arrogant, doesn't want to answer your questions, or for just some reason you guys don't get along, this is like a marriage. This is like, this is almost like speed dating. Like, you get a sense in your gut right away, like this isn't going to work. It's not going to be any better after a surgical treatment. So I think it's important to listen to your instincts as well. But obviously referrals from other doctors, referrals from people who are happy patients, all these things are nice, but it's not always easy to find those things. So you have to be your own detective, I think, in a lot of ways.
Why did you get into this?
So the reason why I decided to become a plastic surgeon was it happened to me in grade school. So when I was in grade school, there was a girl in my class who had a cleft lip and palate deformity, and she was on my bus route, and kids would torture her. It was unfortunate, but especially back then, because now we're very focused on anti-bullying and like you can't get away with the behavior that used to happen when I was a kid. But people would throw things at her, and they would assault her. Nobody would go near her. They would, and it was because she had a facial disfigurement, unfortunately. And I was her friend. I used to sit on the bus with her. And the thing is that she had surgery during the time that I knew her. And as her appearance started to morph and become more normalized, people started to respond to her differently. And I thought that was a very powerful thing. That's the reason why I became a plastic surgeon.
Wow. Because I think of who my dad is, I've done a lot of reading about different personality types and what kind of people become surgeons or CEOs. And generally speaking, from what I've read, it's very disagreeable people who are low in compassion who become surgeons and like go up to the higher levels in businesses.
That's not universal. There's a higher percentage. It's not that that's the majority of us. But like the thing is like, for example, the rate of sociopathy, people who are sociopaths, who are people who are stockbrokers, physicians, politicians, surgeons specifically, is much higher than the average person out there. But it doesn't mean it's the majority of people who go into that profession. You know what I mean? So it's a little bit skewed, but it's definitely, hundreds of percentages more than the average person who has a job that's outside of that field. You know what I mean? But there are a lot of surgeons who are very compassionate. But the thing is that there's a lot of physicians who meet that more aggressive personality type, if you will, as surgeons. Physicians in general, not necessarily, but people who are drawn to these kinds of fields like plastic surgery, orthopedic surgery, things like that tend to be more like that.
Interesting. So do you still do cleft palate? Do you do cleft palate surgery?
Yeah, I do. So I don't do it in my private practice. What I do is I go on 2 missions a year to South America where I do congenital birth defect surgery. So I know how to do it. It's not my focus in my private practice. My passion in my private practice is doing these kinds of rejuvenative procedures. It's what I publish, studies on. It's what I lecture about. It's, what I do every day. But the thing is that, I stay true to that one thing that kind of got me here, which is to do that surgery. When I go to these countries, in an average week, we'll do like about 100 kids. And we'll do surgery on them. So I go to Quito, Ecuador every year. And then I go to Colombia in South America every year. And I go to the same locations because they're endemic. They have areas where they have high rates of these genetic birth defects. So high rates of cleft lip and palate deformity and other things. And I go there and I do it, twice a year for like 10 days. We have to go, we have to screen the patients, we do the surgery, we do the post-operative care, and then we're out. And we go back every year so we can see the kids. And we have doctors back in those countries who will see them through their recovery phase. But they don't have the expertise to do the surgery, unfortunately. And as a result, we keep going back there to do the work.
That is so amazing. Like I've seen some of your before and afters for cleft palate surgery. And that, like you said, would completely change somebody's life. Completely.
Well, it does, because like literally within an hour procedure, it's really, very, it's like mind-numbing. I mean, when you do the procedure and you hand that child back to their parent, looking normal again, it's pretty crazy.
Oh, wow.
It's pretty wild.
Wow. Okay. That's fantastic. I'm glad to hear that. Okay. I think let me ask you another question here. So you talked about lasers a bit. You said lasers to help bruising. So you've actually seen evidence of some of this. Is it low level light therapy?
No, it's something called a pulse dye laser. You can't really use it yourself. It's a very expensive piece of equipment. It's called a V-beam, the one that I use, and it uses this particular wavelength of light. It gets absorbed into purples, and then it actually breaks up. Your body can reabsorb it. So, it's not something you can do at home, like a light therapy or an LED therapy or something like that. Unfortunately, it needs to be executed by a physician who has this kind of equipment. And most doctors don't have it because it's, say a couple $100,000 for the machine. So most people like, oh, the bruising will go. For me, my patients, they really need to be able to get back to things quicker. So we have a V-beam when we treat our patients with it, post-operatively to get rid of it. Yeah.
Does that stop any of the healing that happens with bruising?
Yeah, the bruising doesn't create healing. It actually makes it worse because when you have blood that sits in the tissues, which is what bruising is, it takes more time for your body to wear away at it. So it slows down the healing process. So being able to break it up with this technology actually makes the healing faster.
Wow. That is so cool. Okay. That's fun. And how about these? Do you know anything about the lasers people can use at home? Like these low level light therapy lasers. Have you seen anything effective, or those red lights? Is any of that real?
Yeah, for me, it seems very anecdotal. So what I mean is that I have lots of patients who do it, and they feel like they have great results. There aren't a lot of studies that show that it's really effective in a way that we would look at it scientifically as doctors. But the problem with these things is that there's something called the placebo effect, which most people know. And the placebo effect means I give you a sugar pill, and it'll make people's, like, for example, if they have high blood pressure, 30% of the time it'll make their blood pressure drop. Now, it's just a sugar pill. But the idea in our minds are so powerful that it can really make physical changes in our body by the mere suggestion that it is going to be helpful to us. So if I took these light therapies and I gave it to 100 people and I convinced them that it was going to make them look better, 30% of the people would actually look better. And it would have to do with their body's reaction through their mind and change their physicality. So when we look at the effectiveness of a treatment, it needs to be greater than the placebo effect. But most things are just the placebo effect. That's why we take vitamins and we feel better. Does that mean that it's better than taking a sugar pill? No. But the thing is that 30% of the time we start a new regimen and it sets a neurologic, biophysical, thing that happens within humans that actually makes things better. So that's why I think that we get drawn to different remedies, whether it's drinking a tea, using a light therapy, taking vitamins, even doing, certain types of rituals. They can make us look and feel better. And it is real, so it works. But whether you should invest a lot of money in it or not is the question. Is it really that effective? And for me, I know that data just isn't there for those treatments. But it's okay. It's not bad to try them. They're not going to hurt you. And if you seem to benefit with them, I say continue on with them.
So what does a day in your life look like? Like, how often are you in the operating room? How many hours do you work? When do you wake up?
I wake up at about 4:30 in the morning. I'm in the office early. I usually start my first surgery about 6 o'clock in the morning. I try to do 2 surgeries a day, like in bigger surgeries, I do 1 in the morning because, I take my time, I take a break, and then I do my second procedure in the afternoon. And then I usually finish with surgery sometime in the early evening. And then I see patients and do consults. So I have to see my patients who I've done surgery on, different phases of healing. But I usually finish with work probably somewhere around 8:30, 9 o'clock at night. I try to work only on average, depends on the week, but at this point in my career, I try to work either 3 or 4 days a week. So I don't work 5-day weeks. I work, and when I'm here, I'm doing that. So I'm a surgeon, that's what I do, and every day that I work, I operate. That's what I love to do. But I don't operate 5 days a week, I don't operate 6 days a week. I do 3 days a week, and then the next week I'll do 4, and then I'll go back to 3. And the reason why I do that is because in order to be able to stay focused, creative, and desirous of my profession, I don't want to be exhausted by it. And I love what I do, but I also love not doing what I do. And taking time and space to be able to focus on other aspects of who I am as a person actually makes me a better surgeon. So the thing is that I like to do lots of creative things. I like to draw, I like to paint, I like to sculpt. I like to be outdoors. I like to do lots of stuff. But doing those things give me the space and the ability to think about who I am and what I do and how I do it. But being too entrenched and too focused and working too much, it actually starts to make you sort of lose, the creative process that's required to be good at what I do for a living, because you should always be evolving and changing. But if you're just hammering away all the time, how can you have the time and the space to reflect? It just isn't there.
And then everything you do turns into an obligation, right? Instead of something you want to do.
Yeah, it becomes an obligation. It becomes a burden.
Mm-hmm.
You could work a 15-hour day, but if you love it and you have a time for it, but you have a time away from it, 15 hours is nothing. But if you're doing 15 hours a day, 6 or 7 days a week, it becomes a problem. So,
yeah. How do you think you're able to look at a face and see what could potentially enhance it or make it look younger?
Yeah, that just comes with a massive amount of experience and having made a lot of bad judgment calls. The reality is that when it comes to these kinds of pursuits and a lot of professional endeavors, there's an old saying that I love to say over and over again, because I teach a lot of surgeons and I have fellows that I teach, is that, judgment comes from experience and experience comes from poor judgment. It takes a lot of time, a lot of reflection, and a lot of mistakes to become excellent at what you do. It doesn't just happen. It's not a matter of learning. It's a matter of the process. And as you go on, you get better and better at what you do. It's just like looking at artists over the arc of their career, because I do think this is a very artistic endeavor. Work changes so significantly throughout the course of their lives and their career. There's like the early work, the mid work, and then the stuff that usually is more defining, which is their later work. And it's an evolution. It's a process. So it's not like I can really teach somebody to have my vision for what I see when I'm going to operate on somebody. Of course, I try to, and that's why I write textbooks and I publish papers. I want people to be able to have techniques and tools in their belt to help them make them better. But really what we're doing is we're creating an artistic endeavor when we do surgery on patients. And it's something that comes from my brain, my eyes, and my reflective experience over thousands and thousands of patients. So as a result, it's very hard for me to explain to you, because it's not like I look at a face and I have a formula, like I measure, I do that, and it's not formulaic. It's that I see things, and as I see them, I can see what's off and what needs to be created and what needs to change to create a more natural, more beautiful appearance. And of course, I discuss that with the patients. I'm like, they're my canvas, and I just do whatever the hell I want. But the thing is that, my hit rate is very, very high because of the fact that I've had those experiences and I've learned from them.
Fascinating. Okay. Well, if people want to learn more about this, is there a website they can go to or a book they should read? Where can people find you online?
Yeah, so a couple things. So I have a book that I published. It's called The Park Avenue Face. You can get it in bookstores or on Amazon. And it goes through a lot of this stuff. It talks about techniques and procedures, what works and what doesn't, what things to avoid. Like I talked about fillers. All the stuff is in my book. It also talks about facial proportion, beauty, and all of, it's a little bit like a crash course, but it's very much made for the lay public. And I use, the language that I use is really so that people can engage it as a lay person who's not a doctor. Because I publish for physicians, but then I publish for the lay public to educate them so they can avoid making the pitfalls and the missteps, getting treatments or surgeries that are going to create problems for them. With that in mind, serving the patient. So that's a great thing. It's called The Park Avenue Face. You can get it on Amazon. You don't have to go to a bookstore. Otherwise, you can find me on social media. I have a big Instagram following at Dr. Jacono. It's DRJACONO. And then my website is really long. It's NewYorkFacialPlasticSurgery.com, all spelled out. No abbreviations, no periods. newyorkfacialplasticsurgery.com. And I got that URL, 25 years ago when I was a resident. So I never changed it, and I never will. I'm like one of those people, like once I make a decision, I stick with it when it comes to those kinds of things.
That's not a bad URL for what you do.
Yeah, it's not, but it's too long. I mean, there's got to be something that's more brief, catchy, and memorable. But like thinking about typing that in, NEWYORKFACILPLASTIESURGRY.com, it's a little bit much.
Okay. Well, thank you, Doctor, very much for coming on my show. That was enlightening. It's a very interesting topic.
Yeah, well, it was great talking to you. Hopefully I didn't overwhelm you with all my thoughts. It's a little bit much, sometimes a little bit too much going on up here.
No. That was good.